My doctor told me yesterday that I have to cut my alcohol.
Now, when you told her
I'm gonna have to be a lot more clear next time.
Hello everybody, welcome to my channel, or welcome back to my channel. My name is foot.doc.dana, and I wanted to take a moment for us to reflect back on our year. And by our year, I mean all of the funny videos.
You gained how much weight? Congrats! You looked like a stick the last time I saw you. You're fat now. Yeah, so good catching up with you. I hope I never see you again either. Alright, take care.
Oncologists are always so sweet.
So there's actually a reason why you think the left side of your face looks better than the right.
Go on.
He saw his opportunity, and he took it.
I breathe underwater using an ancient technique. And it's easier than you think. It was used in the lost city of Atlantis. In your mouth you break up water into oxygen and hydrogen. And that's cap.
If you ever think you're dedicated to making a TikTok, just know this man is underwater somewhere in a full Scrubs getup with a Scrubs cap and a mask around his neck, putting a cap on, just to say that something is a lie. So don't tell me that you're not as committed as this man.
Okay, med student, I want you to give me the origin of this artery right here. Wait, which artery are you pointing at? This artery right here. I don't know how I can be any more clear. Okay, yeah, so the origin of that artery is the heart? You know what? I'll give you that.
Sometimes it's a little hard to identify things, especially when you're new, because everyone's a little bit different and things don't look exactly like they do in the textbook. So someone will point at something and it looks completely foreign, and you're just like, yeah, that's definitely the artery.
So I wake up every morning at 5 a.m. to go to the hospital instead of staying in bed, and I scream to the top of my lungs, "Ah!"
Are you okay, Robert? He hasn't posted since October. He's fine, I'm sure he's fine.
Absolutely! I'm fine!
Dudes say getting kicked in the balls is much more painful than having a baby. Oh, is it, tough guy? Well, did you know that the average woman pushes for at least 20 minutes when they're in labor? So let's put this to the test. Why don't I kick you in the balls for 20 minutes straight? And let's see if you can handle it, big purple ball boy.
Dr. Yoon is so funny. I think this video has been seen by half of the planet at this point, and his hot takes become just like normal takes because they're just that good. It's just so good.
If you had to choose to be one bone in the human body, which one would you choose and why? I'll start. The humerus. For obvious reasons.
I mean, okay, if I had to pick one bone, it would have to be a foot bone. And there are 28 bones in the foot. I think it would have to be the talus. It is the bone right on the bottom of the ankle joint because it's all tucked in. It's the very central portion of the ankle joint, and it just controls all the movement of the foot. And most of the surface is covered by cartilage because there's just so much movement on it. And it's just such a very special bone. And I am a special person. I should calm down with the foot stuff.
Because really, I'm fine.
Babe, is it true that you get to listen to music in the OR?
Yeah, of course. We're not savages.
Honey, are you drawing me a diagram?
Yes. Okay, so these are all the people in an operating room. Here's the patient. Here are all the different surgeons. Sometimes as a medical student or junior resident, you have to know what kind of music your senior resident or your attending knows, or else they'll like play the music and then you choose something they don't like. They may not be in a good mood.
You pick the wrong music, you're out. Get out of my operating room. Get out of this hospital. You're banned from this program. You're banned from this specialty. Get out of here.
Do me a favor, please. Get out of here. Get out of here, man.
No, you gotta stay active at every age. They're having so much fun, I love it. Is it a headache from not drinking water or a brain tumor? Am I extra thirsty or do I have diabetes? Is my leg sore from running or a blood clot? Are these cramps or do I have appendicitis? I have unironically thought 2 out of 3 of these over the past few years. And it was way worse when I was first learning about these. Like, here's this rare disease that 1 in a million people have, and I was like, yep, I have that, because I have 1 out of 10 symptoms of it.
My doctor told me yesterday that I have to cut my alcohol.
Now, when you told her, I'm gonna have to be a lot more clear next time.
She's doing her best, you know? In all seriousness, part of the new curriculum that they teach doctors is to ask the patient to repeat things back in their own words to make sure that there's a complete understanding between doctors and patients, kind of what the plan of care is and what's going on.
When people ask me what surgery is like, I send them this video. Yes, this is real.
Orthopedic surgeons wake up every single day and they choose violence. Like, even if they're helping people, they still choose violence.
Hey, little Johnny, we'll go ahead and get you on back. Well, that was unnecessary. Let's go. Okay. Take it. Can you please stop? Now, I will be right back. Now, just don't get in any more trouble. He's just a kid. He's just a kid. He's just a kid. Hey, Johnny, how's it? Oh! Helicopter! Oh, I'm so quick.
You know that these skits are based off of real events. You just know. This is based off of a real kid. And he might be watching this right now, being like, oh, that's me.
Tell me about yourself. No. Why? Because it's pointless small talk and you have better things to do. What are your weaknesses? My physiologic need for sleep. What are your strengths? My desire to eliminate my physiologic need for sleep. A patient presents with head trauma. In the room you find ophthalmology, ENT, and emergency medicine. Who do you yell at first? Trick question, they all know they've wronged me, so I don't even waste my breath. You're in the middle of a 17-hour surgery and need to use the bathroom. What do you do? I'm already wearing a Foley catheter, so nothing. Are you married? For now. Do you have kids? I don't know, you'll have to ask my wife.
A couple people tagged me in this asking if it was accurate, and I said, yeah, for neurosurgery, for me, it's maybe a little bit less so. We're known as a little bit more lifestyle friendly. This is so funny though. This guy is so spot on. That was it, some of the most liked videos from this year. Which one was your favorite? Let me know in the comments down below, and I'll see you guys next time.